Constipation is a very common problem and occurs in about 16% of the general population. Now, how do we define constipation? Some people define it as less than 3 bowel movements a week, or hard stools or difficult to pass stools. Now, depending on which definition we use, studies show that the prevalence of constipation in older men and women above the age of 65 is anywhere between 30 and 35%. Now, are there lifestyle changes that we can implement to help prevent someone from getting constipation? And if someone has constipation, are there things we can do to help improve the situation? So the answer is yes. And as you may have guessed, exercise is one of those lifestyle hacks that we can implement to both prevent and help treat people who have constipation. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. There are approximately 2.5 million visits to the doctor every year because of constipation. Now, can exercise help prevent people from developing constipation? So there was a study of 62,000 women, and they gave them a questionnaire asking them questions about their bowel movements. And people who had less than 2 bowel movements per week were considered to have constipation. So women who reported physical activity 2 to 3 times per week, they were associated with a 35% lower risk of constipation compared to those who were doing less than once a week. And then women who reported physical activity every day, they were associated with a 44% lower risk of developing constipation compared to women who engaged in physical activity less than once a week. And then women who were both physically active every day and had approximately 20 grams of daily fiber had a 3-fold lower prevalence of constipation compared to those women who rarely exercised and only had about 7 grams of fiber daily. How quickly food goes through our digestive system is called transit time. And as you can imagine, the faster the transit time, the more frequent our stools are likely to be. So there was a study of healthy volunteers between the ages of 20 and 40. And the study was divided into 3 one-week periods. So during each period, the subjects either ran on a treadmill, or they cycled on a bicycle, or they just rested for 1 hour. And they found that for those who were running or cycling, the gut transit time was reduced by 30%. So food traveled through the digestive tract much faster, which should translate into more bowel movements. We just spoke about preventing constipation from happening. But what about if people already have constipation? So studies show that people who have constipation and they exercise, it can help improve their symptoms. When we use the term constipation, it can refer to different aspects of the difficulty of having a bowel movement. For example, it can be considered straining in more than 25% of defecations. It could be hard stools in more than 25% of defecations. It could be the sensation of incomplete evacuation in 25% of defecations. Or it can represent less than 3 bowel movements per week. There was a study that randomized about 40 people who were over the age of 45 to either have exercise where they every day did brisk walking for a half hour and then about 10 minutes of resistance training. And then they compared that to a control group that wasn't doing exercise. And these were in people who had constipation. And the study found that the group of people who were exercising had reduced percentage of defecations that required straining, reduced percentage of hard stools, and a reduced percentage of incomplete defecations. So this study showed that exercise can help improve difficulty that people have with bowel movements, those difficulties falling under the category of constipation. As a treatment modality, how does exercise rack up and compare to other options? A meta-analysis of 9 randomized controlled trials involving 680 participants looked at this. And they found that aerobic exercise, such as walking, was 2 times more likely to improve constipation symptoms compared to usual care, normal lifestyle, education about constipation, herbal laxatives, and acupuncture. How does exercise both help prevent and treat constipation? And here more research is needed because it's not exactly clear how, but there are some theories. And these include the following. Exercise increases propulsive movements in the large intestine, mechanical stimulation from the exercise, changes in blood flow to the gut, and changes in hormones. Let's wrap up this video and go over a few key points. Number 1, constipation, very common problem. Number 2, exercise can help prevent constipation. And number 3, for those people already suffering from constipation, exercise can be a successful treatment option. Thank you for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.